An obese patient on medication for years for lifestyle disease, high cholesterol, triglyceride, hypertension, diabetes, neuropathy, etc. was able to taper off medications and stop them with a clinically supported lifestyle correction. We'll see how long it took the patient for symptoms and discomforts to subside, lose 20 kilo of weight, and overcome allergy and sneezing. We shall also see how lab tests helped in evaluating improvements in health, which helped to reduce and stop chronic medication for multiple diseases, and most importantly, how long it took for HbA1c, SGOT, SGPT, cholesterol, triglyceride, uric acid, etc. to reach normal levels without the support of any medications. The series is about my experience with the patients who took clinically supported lifestyle correction to avoid surgery and taper off medications. This can help you understand how valuable are the lifestyle corrections needed for overcoming any chronic lifestyle disease. Most importantly, what advantages such an approach has when deciding on undergoing surgical procedures or continuing with the lifelong medications. To know more about the different lifestyle diseases, treatment options, reversal of lifestyle diseases with the lifestyle modulation, etc., you may search our healthcare channel. When we come to the details of the patient, this is a male, 47 years, height 166 centimeters and weight 94 kg. When we come to his medical history, he is having dyslipidemia, that is high cholesterol, triglyceride, etc. for the last 20 years, and diabetes he's taking medication for last 2 years. Fatty liver is there, hypertension he's taking medicines, neuropathy, he's already having diabetic neuropathy and he's on medication for that, high uric acid, and obesity is there. When we come to the family history, his father is also diabetic, hypertensive, and dyslipidemia is there, and he's on medication and he had a angioplasty or bypass and so many problems he's having. And mother also diabetic and hypertension and dyslipidemia. They both are cardiac patients also. And when we look into the details of the patient, what is his discomforts? Actually, symptomatically, always the patients are worried about the symptoms. No? So, his main symptom is numbness and burning extremities, that is neuropathy. Maybe diabetic neuropathy may be the reason. Anyway, we generally call him glove and stroke neuropathy. The extremities will be, the nerves at the extremities is damaged. That is actually the problem. And he finds it difficult to sleep. Everything is disturbing. It is very much disturbing. And the next is anxiety and palpitation. He has to give speech and interacting with the people. So he finds it difficult because of the palpitation and anxiety. When the anxiety comes, the palpitation, the heartbeat increases. And also there is dyspnea. When he is climbing stairs also, he is having dyspnea and palpitation comes. Then gas and acidity problem and heartburn is there. And allergic sneezing and also itching of the only that it's not basically allergic itching. Actually, the leg only he's having itching and some dark patches are developing in the leg. Next is snoring. That is very common with the patient with obesity. Snoring is there. So I find it difficult to sleep with him. Next is hair fall. He's having balding. So this is male pattern hair loss is there. Balding and hair fall is there. Next, when we come to the medications, he's taking bisoprolol for hypertension, rosuvastatin for cholesterol and dyslipidemia, urodeoxycholic acid for twice a day for this fatty liver actually, and pregabalin, that is for neuropathic pain, this numbness and neuropathy, metformin for diabetes, and folic acid, Evion, vitamin D3, so methylcobalamin. These are supplements taken for this discomforts actually, mainly for this neuropathy. Methylcobalamin is usually given for the neuropathy pain, and allopurinol, that is for high uric acid. Then when we come to the blood reports, before we start clinically supported lifestyle correction, we do a detailed blood and physical examination actually. This with his HbA1c is 7.4. 7.5. That is reasonable control for a patient with going on the modern medicine treatment like insulin and oral medication. But for the clinically supported lifestyle correction, we don't take it as a control or normal. We need around 5.5. That is our aim for the treatment. And we'll see whether he's able to reach that. And glucose level was 177 and insulin was 10.7. Usually type 2 diabetes patient, especially on medication, will be having a high insulin level. Hyperinsulinemia will be there. But this patient, the pancreas is not, pancreas has its limitations. So pancreas is not able to make so much of insulin. That is why his insulin level is only 10.7. It's normal range. And pancreas is able to make insulin for a sufficient. That is why he will be able to stop the diabetic medicine. Cholesterol is, even with the medicines, cholesterol and triglyceride is very high, 321, 253. And HDL is normal. Uric acid is 10. It's very high. Even with he's taking on medication for high uric acid, he's taking, but it is, even with that, his uric acid is high. SGPT and SGOT is high. That means hepatitis is there. He's not alcoholic, so it is non-alcoholic hepatitis. Then albumin, that is another liver parameter, liver function test parameter, which is also high. And vitamin D is low. And HSCRP, that's a cardiac marker or inflammatory blood vessel inflammation marker. And it is also high, 3.4. Next is scan report. We do usually only the ultrasound scan. For the, not CT scan or MRI, we usually don't do. And for the ultrasound, for the cancer patients, we go for the PET scan. Directly, if it is if we're suspecting cancer, we go for the PET scan. So just to minimize the radiation for the to the patient. For this patient, only the ultrasound scan is necessary. The abdominal ultrasound shows he's having fatty liver, grade 2, and prostate enlargement, benign prostatic hyperplasia. And Doppler studies of the this carotid artery. The Doppler study is to assess the atherosclerosis or the fat deposit on the or the blood vessel block. It is best to check the carotid artery that is supplying the brain. It's a big artery. It is very close to the skin. So we give the ultrasound scan. We can assess and the aging can assess the aging of the blood vessels. In that, actually, he is having atherosclerosis is there, and cardiac echo was showing reasonably okay, only trivial or mild regurgitation and things. Next, when we come to the diagnosis, what was the final diagnosis? What are the diseases? There are so many diseases because not a single diagnosis. In most of the lifestyle disease patients, there will be so many problems. Many organs will be involved. For him, the chronic liver disease is there, CLD, the fatty liver grade 2, and NASH. That is non-alcoholic steatohepatitis. According to the modern classification or the modern nomenclature in the modern medicine, it is MASH. It is called MASH and metabolic dysfunction associated steatohepatitis. Previously, it is non-alcoholic. Now, metabolic dysfunction associated steatohepatitis is there. And diabetes, hypertension, obesity, and gastric problem and GERD. That is gastroesophageal reflux and acidity problem is there. Allergy is there, sneezing, respiratory allergy is there. And this rhinitis, allergic rhinitis is there. Anxiety, psychological problem, anxiety is there. And hyperuricemia. And uric acid is high. BPH, that is benign prostatic hyperplasia is there. Dyslipidemia, cholesterol and triglyceride is high. And as a result, there is atherosclerosis. Fat deposits in the blood vessels and the blood vessel is getting blocked. And android alopecia, it is balding. That is recently it is considered as according to the latest studies, it is considered as an autoimmune disease actually. So multiple parameters is abnormal for him. And next, what with so many problems, metabolic syndrome is there, allergy is there, suspected autoimmune problems is there. Then he is taking all the medications but not much benefit. Then what we can do with the lifestyle correction? See, with this many medicines and this many problems, then they will not be able to manage with the self-lifestyle correction. That is why he is not becoming overweight and multiple symptoms and problems are coming in. So in such a case, patient, what is done in a clinically supported lifestyle correction? Basically, it is giving three factors we are giving importance. One is giving optimal nutrition. But because he is overweight, he has to give a low calorie diet. Around 650 calorie and all nutrition. That is our aim. And then is exercise. Exercise, mild exercise, that's usually in the lying down position, but exercising all the muscles, around 650 muscles and 230 joints in our body. Exercising all this, and so that it will indirectly stimulate all the organs in the body. When you are exercising, you are getting stimulated, the brain is getting stimulated, heart is getting stimulated, and all the internal organs get because the blood circulation is increased to all the organs actually, in such a way that the exercise is designed, and to minimize the toxins entering the body, to avoid color and preservatives in the food and cosmetics and such things. Minimize the toxins entering the body, and to remove the toxins by increasing the circulation. So if you are increasing the circulation, the liver and kidney and the skin will remove the toxins which is already deposited in the body. He is so much obese, and his obesity, this excess fat in the body itself is acting as a toxin actually. Next, what was the changes happened with the clinically supported lifestyle correction? First, we'll go into the symptoms. Patient is always worried about the symptoms because of the symptom only the patient is going to the doctor. When you have pain or discomfort, you are going to the doctor. So, what was the benefits or what was the improvements in the symptom with the clinically supported lifestyle correction? And usually, when we initially will do all the investigation, then when we start. First 2 weeks, every 8th day, starting, and if you take it to day 1, in 8th day and 15th day, then 30, 60, 90, that is the pattern of follow-up. In between, in the hospital follow-up, in between, or the outpatient follow-up. In between, we'll check, follow the patient online also. In this, his main symptom was the disturbing symptom was numbness and burning extremities. Actually, by the 8th day, it is reduced by 80%, and 15th day, 90%, and by the 30th day, there was no neuropathic pain and discomfort is gone. Next is palpitation and anxiety. So it was connected actually. So anxiety and palpitation was connected. And he's saying that it is almost 50% palpitation is gone, anxiety is reduced to 80%. And by the 8th day, and by the 15th day, it is the palpitation also is reduced. Palpitation is really not along with the anxiety, and also with the climbing stairs syndrome. Both was reduced to 80%, and by the 30th day it is gone. And this anxiety problem is around, it's almost gone by the 15th day itself. And allergics and sneezing, that is this nasal allergy is reduced to a great extent in the 8th day itself, and then a little bit by the 15th day, and it is gone by 30th day. And skin discoloration, that is actually that itching is gone by the 8th day itself, but the discoloration is it took a little more time to, that is natural. It will take almost 1 to 2 years. The skin cells has to replace everything. The changes happens with the clinical supported lifestyle correction. It depends on the change in the replacement of the cell, damaged cell with the healthy cell. The skin cells need at least 1 month, 3-4 weeks for replacement. So it took almost 1 month for the correction. The hair fall and balding, it will not be corrected immediately because this hair follicle is damaged actually. It has to regrow. It may take time. 90 days, new small hair follicles started appearing. So if the patient is persisting with the lifestyle correction, it can improve further, and may at least whether because he had a major hair loss, the vertex is almost gone, only a few hairs in the center and the other things is gone. So he may definitely improve, and if it is many of the patients who's in the initial stage, only some back patch in the vertex, the back part of the head, those patients it will really appear within 3 to 6 months, substantial improvement will be there, but it will not sustain if you should continue the lifestyle correction and optimize your body composition and all is important for maintaining that too. Next, about the medication, that is one of the major botheration for the patient. No? So by the 8th day when he was taking only this bisoprolol half tablet a day. All the other medications he has stopped. Actually, usually stop the medication because his cholesterol and all is very high. Actually, we usually stop only the reduce it to half, then alternate days, and then stop. But he stopped himself because he is so comfortable, and he decided himself to reduce. And also this urodeoxycholic acid, we stop only initially after the liver enzymes start reducing to normal. Then if it is taking twice a day, once a day, and then stop. That is our pattern of doing. But he stopped his own by the 8th day itself. The patient stopped. This is not advisable, but he did like that. But the diabetic medicines and all this nutritional support and all, we stop at the first day itself. But all the other according to the parameters. And for the uric acid also he stopped. But then we'll see what happened with the blood report, even though he stopped abruptly. And HbA1c, that is, diabetes is one of the major concerns. HbA1c 7.5 reduced to 6.9 on the 8th day. Usually HbA1c is checked with conventional medication and insulin treatment for the diabetic patient. Once in 3 months only it is looked into. But in clinically supported lifestyle correction, in the beginning till your substantial reduction, we check initially in the weekly and then monthly. It was reduced to 6.9 by the 8th day, and 6.7 in the 15th day, and 6.3 in 30th day, and 5.8 in the 60th day, and by 90th day it is 5.5. So it is completely normalized. So that is what we are expecting. The red blood cell turnover, it will take 90 to 120 days. But if the patient is following things correctly, by 3 to 4 months, HbA1c can be corrected to normal. Depends on the beginning, initial level also. If it is 13 and 14 and all HbA1c, it may take some more time, because such patients, it may be a little more difficult for controlling also. They will not be, so they are so erratic in the lifestyle. But this person was very trying his best for controlling actually. Glucose was within 12 hours, the glucose level has come down to normal, and it was maintaining like that also. Even at the hospital visit, which is followed up at home also, he's checking. His insulin level was initially itself normal, so we are not looked into. Again, we didn't recheck. The cholesterol was high, and he stopped the cholesterol medicine immediately. Actually, even though his this cholesterol level has come down, and gradually, and by the 60th day, the cholesterol level, 30th day it is 240, and 60th day it is 228 and 205 by 90 days. So we, as per the cardiologist, you had to keep the cardiologist always advised to keep below 150. But in clinically supported lifestyle correction, we are not expecting it's 150, below 150, because it is not natural. The cholesterol is produced by the body. So blocking, actually the statins and blocking the cholesterol production itself. See, even with the statin high dose, he is not able to get any cholesterol control, and even the triglyceride was high. But after stopping, his cholesterol and triglyceride came down to normal. The triglyceride is normal by the 15th day itself. It is only 93, and it was maintaining normal also. So we are not, because the cholesterol is very essential for the body's normal functioning, like making vitamin D3, and his vitamin D3 was very low. And because of even this cholesterol is high, it was low actually. And for the steroid hormones like testosterone, and the BP controlling hormones like mineralocorticoid, that immunity controlling hormone like steroids, all this hormone production, this cholesterol is needed. So we don't advise the patient for artificially blocking the cholesterol synthesis. Only by doing exercise, that is the correct way of doing. Don't manipulate the natural things. You control your lifestyle, food habits, and the exercise. It will naturally get corrected. That is what it shows. And SGL also keeping normal. Uric acid, he was taking uric acid, loperamide for the uric acid, reducing uric acid, but it was very high. But it is gradually reducing and came down to 5.6 by the 60th day. 30th day it came down to 8.7, and by 60th day 5.6. And SGOT, SGPT, it is his liver is inflamed. That is the this SGOT and SGPT side. That means the liver cells are getting damaged. So that also it was 131 and came down to 30. That by 30th day it is 23 only. And SGOT also, it was 72 initially and gradually came down on 22 only by the 30th day. And albumin, that was also high, that is another liver parameter, that is also came down to normal by 30th day. And vitamin D was low, but came up to normal by 30th day. And HSCRP, it's an inflammatory marker and cardiac marker. That time, if the HSCRP is high, that means the heart attack risk is high. It is reduced to normal within the 8th day itself. So all the blood parameters are coming down to normal gradually. By the 90th day, everything is normal. The last came down to is HbA1c because it needs certain things needs its time to correct also. Next, about what was this status of the fatty liver? Actually, by the 8th day, by the 30th day, we usually do the ultrasound scan. Scanning is usually for this sort of patients or on the 90th day. So his grade 2 fatty liver came down to grade 1 fatty liver, and BPS, benign prostatic hyperplasia, it came down 28 cc to 26 cc by the 90th day. And also this residual urine, that is for the prostate patients, always the scanning look for the residual urine, that is how much urine is retained in the bladder after passing urine. That is an indication of the severity of the disease too. So initially he had residual urine 31 cc and it is reduced to 23 cc by the 90 days. And what about the atherosclerosis, the fat deposits which is creating block in the arteries? Actually, initially it was 1.3 ml, that is, we are measuring it in the carotid artery, but it is a representation of the blood vessels all over the body. It is almost, your body has almost 60,000 miles of blood vessels actually, the whole body, human body. So it is a representation of all over the body what is the damage created by this high cholesterol and triglycerides in the body. And by 90 days it is came down to 1.1. And we are seeing that if it is followed up, it will come down. If the patient is following the lifestyle correctly and following the parameters correctly, it will come down and completely disappear. Even the calcified plaques, atherosclerotic plaques, the calcification also slightly gone. That calcification means it is because of the inflammation, the calcium are depositing. If you are correcting it, calcium also will be resorbed by the immune system and it will also get corrected. It may, if the calcified plaques and all, it can take years, but you have to continue the lifestyle, maintain the healthy lifestyle, then it can also be reversed. Next, we will look into what happened in the body parameters. His height is 166 centimeters and his weight was 94.5 kg in the initially. And his age is 46 and his body age was 64. So, from 94.5 kg, he was able to come down to 74 kg within 90 days. And his BMI was 34 and came down to 27 by 90 days. And BP, he was with the medication, his BP was initially maintained and it came down to, it was maintaining like that actually. And abdominal circumference, that is abdominal obesity, is an indication of this heart attack and other problems actually, and it's an indication of the atherosclerosis actually. This is initial was 105, it's very protruding tummy, and it came down to 89 by 3 months. And body age 64, he was so much accelerated aging, almost 23 years accelerated aging is there, and it came down to 51. It is actually, his body age is only, real age is 46, but 64 it came down to 51. It's a real achievement. And fat percentage, it was 30.7 and it came down to 22%. So the fat percentage ideally in the men, it should be between 10 and 20. So it is now also his body age and the fat percentage is high. It will take some more time for the correction. More effort is needed. Then we come to what is the before and after. We always see the pictures of before and after the body, this weight reduction and all. Here the weight not only the weight, the whole other aspect also we have to check. When the symptom wise, that is the most important for the patient point of view. This palpitation, anxiety, neuropathy, everything is corrected so many symptoms was there. It was all corrected by the 90th day itself. Actually, it was most of the things were corrected by 8th day, 15th day, 30th day. So it's corrected. The only thing which is leaving is the balding. That we cannot correct within 30 days or 90 days. It will take time, and new hair follicles have started growing. That means in indicate it is possible that at least some extent, some hair follicle, dormant hair follicle are there. Those will be definitely regrow if the patient is continuing with if the hair follicle also needs the correct nutrition, and the toxins should be avoided, and the correct nutrition should, and also this is controlled by the hormones. This is the hormonal imbalance is the reason for the balding, and the hormonal imbalance is happening because of the excess fat in the body. So that is corrected, it can regrow if it is not fully damaged. Then about the medication, he was taking so many medications, and it is there's no medication. By the 58th day itself, he stopped all the medicines. And whatever the blood report, by the 30th, 90th day, everything blood parameters was normal. Yes, the decrease we have seen earlier. Ultrasound scanning, fatty liver grade 2 to grade 1 by 90, and prostate was reduced in size, and the atherosclerotic plaques, the blocks in the arteries also was reduced. Then the body parameters, there was gradual reduction day 1, day 90. There was some more parameters were need to correct. What is the future? What is the plan for the future for this patient? There is weight was reduced from 94.5 to 74, but ideally she should be around 60 kg because his height is 166 centimeters. So it will be for an Indian, it is maximum BMI we can have is 23. It is at least it has to come down to 23 or preferably to 22. So 60 kg again 1 over 14 kg reduction, and the BMI now also it is in the obesity, the margin, which is actually obesity, and the overweight is 27 for the Indians actually. So it has to come down. The BP is maintaining normal. Abdominal circumference, it has come down from 105 to 89, is very good for the 30 days result. But he has to bring it down to 75. Around 75, 70 to 75 will be ideal. And body age, yes, accelerated aging 64, he came down to 51. And the patients should feel that it is not in the digitally your computer or the computer report or it's on the paper. It is actually the patient will feel the change in the body itself. They feel they are much more younger. And actually, for a patient, ideally, if you are 46, is keep your body age few years below the calendar age. Ideally, you can come down to 40 years. Actually, that is what it's basically this clay correction, clinically supported lifestyle correction is anti-aging also. There are so many patterns we are trying to slow down the aging. Actually, you can reverse the aging process. But also studies also, the lifestyle correction can reverse the aging not only externally, at the cellular level also. Cellular level, even in the chromosomal level, even the molecular level, the chromosomal level, this telomere shortening and so many things. We are not going into the anti-aging treatment aspect, but it is actually correcting the growth, not only in the growth level, not only in the cellular level, and in the molecular level, the correction is possible with the lifestyle correction, modulation actually. Because our body is simply, the reason is simply that our body is made of this food. Nothing else is there. And the body's purpose of the body is to do physical activity. If you do these two things and reduce the toxins, you can, the anti-aging and reversing lifestyle diseases, everything is possible. And this fat level, actually the initial fat level was 30.7, it has come down to 22% by the 3 months. But what you are aiming is to bring down to 15%. Next is, what is the difference between, or for this patient, what is his achievement, or what is the benefits he received with this shifting from the conventional treatment to clinically supported lifestyle correction and reversing the disease. See, if he is not coming for the lifestyle modulation, what is his option? It's only increasing the sugar is not under control. With all this medicine, even with the neuropathy medicine, pregabalin and all, his neuropathy pain and discomfort is there continuing, and the palpitation. He's taking medication for that, this palpitation and anxiety, but his problem is continuing. So the only option for the modern medicine is to increase the medication. And finally, he's having this atherosclerosis and blood vessel blocks is already started. He can get a chest pain, heart attack, then again stent or bypass is the option. And he's having, definitely with his obesity, he will develop, he's already having degenerative disease of the knee and the disc problems and all is there. So it will need surgeries for the finally knee replacement. He's only 46 now. And then gradually his weight will be increasing. Adding with the medicines, his weight will be increasing, and he'll be having more and more disease, more and more medication. And then definitely the neuropathy is there, the retinopathy or nephropathy, all can come on the way. So more future surgeries, more medication. That is the only option with the modern medicine. And but with the clinically supported, he is within a month, within a week, he is out from all the medicines. And because of his weight reduction, and even the atherosclerosis is reducing. So if it is continuing with this, there's no possibility of going for this heart attack or the block will not happen. It will all reversed. And future surgeries will be reversed. The need for the surgeries will not be there. Medication and the complication and other medications is not there. And the immunity, if it is the immunity is improved. So otherwise, if you are on medication and diabetic and hypertensive and heart problems, everything, definitely you will be a complex patient. The chance of, if you have an accident or an infection, the chance of recovery will be compromised. That is the problem. So if you are on medication, if you are having a lifestyle disease, if you are on medication, you will always be a complex patient, and your recovery, if you are getting an accident or injury or anything, the recovery will be compromised. So if you are on reverse, you are free and you can enjoy life, and better, the quality of life will be much more. So if you are taking all this medication, because otherwise having so many acidity problems, and if you are gastric problems, it is inevitable. If you are on medication, the gastric problems and abdominal gas, acidity and all will be there. Now he is free of that also. Here in clinically supervised and supported lifestyle correction, what we are trying to do is use the healing power of the body by empowering the healing aspect, the anti-inflammatory aspect of the immune system. First is by providing optimal nutrition. Second, by promoting the removal of toxins by improving circulation through optimal stimulation of all cells by plant exercise. Third, minimizing toxins entering the body through food, water, air and cosmetics. Diabetes, hypertension, heart disease, cancer, liver disease, kidney disease, obesity, stroke, allergies, autoimmune diseases, etc. come under the umbrella of lifestyle diseases. 90% of the medications and 90% of surgeries are of lifestyle disease. This means that 90% of the medication and 90% of the surgeries can be avoided. It is good to understand that neither medicines nor surgery can cure a lifestyle disease. To put it differently, it is not a lack of medication nor surgery that created the disease. This is why once medication is started, very often both the disease and medicines will keep on adding more numbers along with the unwanted side effects. This is why it is very important for you to understand and correct lifestyle while also encouraging others to do so. Another important aspect is when someone is talking about the healthcare and treatment approach, you should consider the scientific background of the concerned person. I am Dr. Jolly Thomson, started medical education in Government Medical College, Kochi as 1981 batch and completed diploma and MD in obstetrics and gynecology from Government Medical College, Thiruvananthapuram, Kerala, India in 1992. After additional training in reproductive medicine and surgery, joined government service. Later resigned from government service and in 1997 started practicing as consultant at Lifecare Center, Thevara, Kochi, focusing on lifestyle modulation with the clinical support for lifestyle diseases, minimizing the need for medication and surgery. Another important thing every patient should understand is patient's role in drug pollution. Major part of the medication we take are excreted in the urine, sweat and stool. It will reach the groundwater, rivers, drinking water, plants, animals and food products. That means the medications we take is becoming a threat not only to us humans but to all the life forms on our planet. Therefore, it is essential to correct lifestyle, reverse lifestyle disease and come out of medications to prevent our children and grandchildren and the coming generations from the ill effect of toxic pharmaceutical pollution. We should come out of the dependence on medication. The current norm of chronic patients on lifelong medications has to change. Spreading awareness on reversing lifestyle diseases and minimizing medication is the need of the hour. Therefore, remember to share this to your relatives, friends and colleagues who are on chronic medication or planning for surgery for lifestyle diseases. Thank you.